Yeah, I certainly think that everyone is feeling something different than they felt 5, 6 months ago. And from the standpoint of our agency, we've seen an increase in our crisis calls that are coming in. We've seen an increase in mental health patients. We've ourselves, as an agency, brought in over 250 clients since the middle of March. I think that we all recognize the impact that what we thought was going to be a time and period to get through is now a time and period that's not going anywhere. And so, I can even speak for myself as a mom of two young boys. When we had to do online learning at the end of last school year, we just were looking at it like, okay, we just have to get through this, anticipating and hoping that the fall was going to look different. And so now we see that the fall isn't going to look different. And in fact, we don't know if the spring is going to look different. So now it's staying the course in managing stress and anxiety and the unknowns, because we are very much we're a human race that needs beginning and ends to everything that we do. We want to know when school is starting and we want to know when school is ending. We want to know when vacation is starting and when it's ending. What we have in COVID is a total unknown. And so as you talk about sort of the unrest in the communities, there are a lot of folks who are having a difficult time managing. And I think we all can say that individually. There's been one time or another where we have responded uncharacteristically because of the situation and the stress and the anxiety that we are feeling. Being able to get out of bed and take a shower and get dressed, even if you're not going to work and you're working from home, routines are really important. I think right now, we are seeing a lot of our young people struggling, and we have seen an uptick in people who are contemplating suicide, and being able to pay attention to that, especially for our young kids and our middle schoolers and high schoolers who have lost so much and are continuing to know that the fall is going to look really different. Our main message right now that we want people to know is that it's okay not to be okay. It's okay to say, I need something different than I needed. Even if you've never been in mental health services before, we all are going to need something differently and are experiencing life differently. So paying attention, opening that conversation with people, the small check-ins of even just sending a text that says, hey, haven't talked to you in a while, how are you doing? But really staying around and making sure that you're staying for the answer of that question. So the difficult thing is that there was a lot of forgiveness of copays from private insurance companies in the beginning, and now that has gone away. Telephone has to be an option for some folks who are not able to get on telemedicine and not able to receive services via video, but the reimbursement for that for us is it's non-existent in some of the private insurance capacities. So we're having to really rely on community donations to be able to continue to serve people regardless of ability to pay. And now I feel like we need to add the tagline, regardless of technology capabilities, because that's really the reality of where we are. We have really strict CDC guidelines that we are following in our office. We continue to see people with masks on in the office, making sure that we're doing our due diligence. But the reality is we do have to live in this telehealth world right now. And as funding is cut from the state level, in the very beginning, there was lots of COVID money that was being sent out to agencies. And that has started to peel back a little bit. Our private donors are rightfully so holding on a little bit differently, and there isn't as much funding coming through our doors as we would normally see. And you look at the business community where we might have had a partnership where the businesses were helping to support some of our suicide prevention programs last fall through our No Matter What You Matter campaign. At this stage of the game, we are really focusing in on supporting those business owners and their employees from the mental health standpoint. So we certainly are seeing a decline in funding. We've applied for more grants in the last 2 months than we have applied for in an entire year. And it is really just to be able to maintain PPE in the office, to make sure that we have what we need to be able to see folks if they don't have insurance or if they're unemployed. Some folks that do have insurance are now saying, my wife is out of work, I can't make the copay. So we're really having to be creative with how to keep our staff here and fully on staff. We've not had to make any cuts to our team through this time period, but there's a lot of people that are needing a lot more financial assistance. And so our loss is in the six-figure number, over $250,000 is what we have seen as loss for the agency. And we really are just continuing to be creative and find ways to be able to bring money in. But certainly there is a need at this time for us to be able to maintain those services. And we need those donor dollars in order to make that happen.